Hey, Dr. C here with you. So, how much iodine do you need while you're breastfeeding? This is a super important topic. Iodine is essential for good thyroid function, and good thyroid function is essential for good health in every way. The odd thing about this nutrient is that the requirements are really narrow, and for some people are even more narrow than others. By narrow, what I mean is that the difference between too little and too much is not all that big, and it's really easy to get too much of that. Breastfeeding is a time to where you're making the nourishment for a whole nother baby, a whole nother person. And we know that your nutritional needs are not the same as they are during other times in life. So let's dive deep in this and make some sense out of it for your own health. For starters, we can think about different categories of women. There's those who have thyroid disease, those who are prone to it, those who don't have it, doesn't show up in the families, and those on thyroid medication. And these are different. If you're someone who does not have a strong family history of thyroid disease, you've probably got more leeway, you've probably got more tolerance, and this may not be as exacting of an issue for you. What happens is that those prone to thyroid disease, they can't function as well on as wide a range of iodine as others can. So yeah, those prone to it are more at risk for getting too much especially, and too much can be harmful for mom and for baby. Iodine does pass from the diet through the kidneys, but some does pass directly into the breast milk. And there's some that is actively concentrated into the breast milk. Because of the concentrating effect, some odd things happen. One of which is that a high dose of iodine ends up being a low dose of iodine for a nursing baby. What happens there is that if you consume too much, there's a point at where it stops your breasts from concentrating iodine into the milk. We would never think about that. It's not at all intuitive. But yeah, a high amount in the body means too little in the milk. And so to get the right amount in the milk, you want to avoid the excess. Now, there are times to where a little too much is just a little bit too much in the milk as well. But there's an easy threshold you can pass to where consuming too much means none gets into your milk. And there have been some cases published of women who were taking iodine supplements and their nursing babies were iodine deficient. And this is the big iodine paradox. It's not a bad thing, but you need precise amounts. And too much and too little can cause the exact same problems. So a little more detail. The requirements for breastfeeding are really the same as requirements during pregnancy. And during pregnancy, a woman needs about 50 micrograms more than she would need during a non-pregnant state. So a woman that has not pregnant, not breastfeeding, probably requires between about 50 and 200 micrograms of iodine for good overall health. Now, if she's prone to thyroid disease, if she's on medication, we're talking about lower amounts then. So during pregnancy and during lactation, that's going to bump it up to about 100 micrograms to about 250 micrograms. That's probably a healthy range. For those who are on thyroid medication, they will need less because the medication also contains iodine. And the main thing iodine does in the mom's body is it's used to make thyroid hormones. But when she's on thyroid medication, she's getting thyroid hormones already. So a lot of iodine is not needed. And what that means is iodine can build up. And the same amount that might be good otherwise could be too much when she's on medication. So those are amounts. And you would seem logical to think, well, how much is in my food? Or can I test myself to see how much is in my body? Both of those are not practical solutions. And the reasons come down to how volatile and how reactive iodine is. The amount in food varies tremendously. When I wrote the Thyroid Reset Diet, I analyzed over 600 foods, and I found more than 50 samples for most of the foods. And I saw that many foods could have a huge range of iodine from season to season, from this part of the country to the next, from batch to batch, you name it. And similar problems exist for iodine testing. There are no simple ways to take one person and accurately measure how much iodine is in their thyroid. You can measure what's in the urine, what's in the blood, but those don't consistently reflect what's in the thyroid for a given person. If you're looking at large numbers of people, like groups of 500 or more, a lot of the problems kind of wash themselves out And you can say what a group average is, even though you can't be correct for an individual. So the more practical approach is to think about food in terms of categories of iodine. And in the thyroid reset diet, I broke food down into 3 categories: green light, yellow light, and red light. And my thought process was I wanted those who were trying to help their thyroid to be able to access foods that would be safe and wouldn't have even occasional high amounts of iodine. So I looked at not just how much iodine the food had in these various samples, but how consistent that was. Some foods usually didn't have a lot, but sometimes had whopping amounts. And I didn't want someone to think that was a safe food they could always have and then have it harm their thyroid or take away their chance of healing their thyroid. So the foods that are pretty consistent to be low in iodine, I call green light foods. And I want to point out these aren't iodine-free foods. They don't have none. They still have some, but they're not likely to contribute to excessive amounts. Then there's foods that have moderate amounts of iodine, but are pretty consistent. You're not likely going to find them having massive amounts on occasion. I call these the yellow light foods. And finally, there's the foods that always or often enough have unsafe amounts of iodine for those with thyroid disease. I call those the red light foods. So when you're lactating, when you're breastfeeding, you want to include at least 1 or 2 servings of yellow light foods in your day's diet. If you're on thyroid medication, that's more like 1 serving of those yellow light foods. What are some examples? Well, green light foods, most fruits, most vegetables, legumes, which are beans and peas, nuts, seeds, typically most animal protein, egg whites. These are things that are really green light foods. So yellow light foods can include Greek yogurt, about like 4 ounces of that, 1 egg yolk, salmon, 4 to 6 ounces of salmon. This can also include things that you might not expect, like prune juice or pineapple juice, or toasted and salted sunflower seeds, or canned navy beans. There's some things that have moderate amounts you wouldn't think of, but they're easy to find. I've got a full list in the Thyroid Reset Diet. You can also get it for free if you go to thyroidresetdiet.com/resources. You can find a detailed list of these foods broken down by their light category. But yeah, if you're not on thyroid meds and you're nursing, you want 1 to 2 yellow light foods per day. You still want to avoid the red light foods. If you are on thyroid medication, then we think about less. We think more like 1 serving of those yellow light foods on a typical day. The rationale here is that iodine makes its way into the breast milk, but again, it's not a simple linear equation. If there's too much, there's a pump that pulls iodine into the breast milk. It's called the NIS, or the sodium iodide symporter, and what it's meant to do is to prevent the body from being exposed to dangerous amounts of iodine. So when there's a lot of iodine, the pump shuts off. So paradoxically, a mom who has, let's say, no iodine in her diet, almost none, and she's iodine deficient, her baby can have the same problems as a mom that consumes too much iodine, because the too much can also create low iodine in the milk by shutting off the pump. So simple solution though, you want to have those yellow light foods and include those regularly. Many think about iodine in salt or iodine in supplements. The drawbacks there, iodine in salt, you can find it as the form of iodized salt or naturally occurring in some types of sea salt or pink Himalayan salt. Now, both of these sources, they will contain it, but the amounts, they're not as predictable as we might wish. And that's why areas that fortify their salt with iodine universally see increased rates of thyroid disease. Denmark was the last big country to do this. Their rates of thyroid disease have gone up every year after the year 2000, in which they fortified their salt with iodine. So it does give you more, but not safe, steady, predictable amounts. The other thought is iodine in prenatal or other multivitamins. Well, they can have it, but the problem with variability is even greater here. One recent large study looked at the iodine in prenatal vitamins specifically, and what it saw was that when they analyzed the products, none of them contained the amount that was stated on the label, not even close, not even within like 5 or 10%. And many of the products contained several times more than they were supposed to have. We talked about 250 micrograms as a safe upper limit for your day's dose. And remember, you're always going to get 50 or 100 in any diet. So some prenatals, when assayed, contained over 600 micrograms of iodine. They didn't say that. They said they only had like normal amounts, but they had that much. So I don't recommend it in supplement form for that reason. Food sources, especially those yellow light foods, those are the best way to get a safe, predictable, controllable amount. And they're easy. There are lots of them. You don't need weird amounts, and you don't need to have foods that are exotic. All right, Dr. C here with you. That's a bit more about making sense of iodine while you're breastfeeding. Take great care. We'll talk again really soon.